Hello, Thrive Nation. I've got a very special nitric oxide specialist expert. He's dedicated his life to studying this molecule, and I do really want to know why. He's Dr. Nathan Bryan. He's a PhD. He's an international expert, published author. He's edited many papers. He's just really dedicated his life as a molecular medicine expert, and as well as he's very qualified in biochemistry. So it's a privilege and honor to have you on the Made to Thrive show, Dr. Bryan.
Thank you, Steve. It's a great honor and pleasure to be with you.
Brilliant. Let's jump right in and tell us, why did you study NO or nitric oxide, and what was your fascination and how you got into this field?
Well, it was an interesting, looking back, it's kind of been an interesting journey. And I never really had an intention of joining this field. I mean, I got a degree in biochemistry from the University of Texas. And I can remember back from my inorganic chemistry courses and thinking how much or how excited I was to get through that and never have to study nitrogen-based chemistry again. Fast forward a few years, and here I am, spent my whole life trying to understand nitrogen-based chemistry. But, I was a student at LSU School of Medicine in the early 2000s. I was working on a PhD in molecular and cellular physiology, and the Nobel Prize for the discovery of nitric oxide had just been awarded a couple of years earlier.
Okay.
And we were fortunate to have Lou Ignarro, one of the gentlemen who shared the Nobel Prize, come to Shreveport, Louisiana, give a lecture in the medical school. And then I had a chance to have dinner with him that night, and we just had a good discussion. And, there were a lot of unanswered questions in the field. He was surprised that a Nobel Prize had been awarded, because we knew, or the field knew, that nitric oxide was important, but there was still so much that we didn't know. Like, what are the production pathways in humans, and what goes wrong in people that can't make nitric oxide? And then perhaps most importantly, it was, how do you fix these underlying problems?
Yeah.
So being in kind of my first year in a PhD, and there was a professor of medicine there that was a nitric oxide specialist, and his whole lab was devoted to studying nitric oxide. So I joined his lab and spent, a couple of years there. I finished my PhD in 2.5 years, then went to Boston and did a fellowship in Boston, and continued to work on nitric oxide, and made a lot of discoveries during that time that furthered the understanding of nitric oxide. And then when I went and got a full-time faculty position at University of Texas Health Science Center, really I devoted my entire, the rest of my academic career towards studying nitric oxide. So that was kind of the introduction into the field. A lot's changed in those 25 years, but it's been exciting. We've made a lot of discoveries that I think has changed the course of medicine.
So those that are listening, obviously we've been running a podcast now for almost 2.5 years, over 100 episodes, and we've had some international health heroes. Why is nitric oxide so important, and why should the listener or the viewer on YouTube be even concerned about nitric oxide?
Well, there's still a lot there's very little awareness around nitric oxide. When I started 20 years ago, there was certainly very little consumer awareness or public awareness around it. We've made some progress, but still I'm surprised. I give 50, 60 lectures a year around the world, both to doctors and consumers. And I'm still surprised about how few people know about nitric oxide. But to answer what it is, it's a molecule that's naturally produced in the body. It's made in the lining of the blood vessels, and it's what regulates the control of oxygen and nutrient delivery to every cell in the body.
Sure.
It's how our cells communicate with one another. It's how our immune system fights off pathogen like bacteria and viruses. And so the older we get, the less we make. And it's the loss of nitric oxide that is the causal event for every single major human chronic disease, including cardiovascular disease, the #1 killer of men and women worldwide. So it's naturally produced. When you can't produce it, you get disease, you get sick, and you die. It's really that simple.
Sure, there's a huge statement in terms of cardiovascular disease, diabetes, cancer, those things that are obviously like pernicious to modernity and what's happening in sort of first world living, to say that. So it's obviously crucially important. And we're going to speak of ways, in terms of how to improve it. But how do we measure nitric oxide? What are the signs and symptoms other than disease? Obviously, you said it's every single disease, whether it's cognitive decline or neurodegenerative conditions, where people are struggling with, or even fatigue or tiredness. I know that that's a common complaint in the last 23 years in my as a physician, I've, yet to hear so many people say they're exhausted, they're tired, they're fatigued, they got brain fog in the morning. It's, surpassed a lot of the other conditions that I treat. But how would someone know, and how do they measure nitric oxide in the body?
Yeah, that's a very good question, and one we've been working on for probably more than 15 years now. So the challenge is nitric oxide is a gas, and it's a gas, and once it's produced, it's gone in less than a second. So the body produces it, it hits its target, and then activates these second messenger systems, and then it's gone. So there's not blood labs you can measure, like if you want to know your patient's cholesterol levels or vitamin D, there's no standardized labs that you can draw blood and then determine your nitric oxide. We do it in the research lab because we know the oxidative metabolites of nitric oxide, and we can measure different departments such as saliva and plasma or tissue biopsies, but it's not available in a standard clinical diagnostic test.
Okay.
So years ago, I guess back in 2009 or 2010, I developed a salivary test strip. And really that was the only point of care diagnostic at the time, because we knew that if you produce nitric oxide in the lining of the blood vessel, it's oxidized to nitrate. And we could also get a source of nitrate from the diet, green leafy vegetables, for example. And then the body metabolizes this nitrate into nitrite in the oral cavity through the action of oral bacteria. And so we would sample salivary nitrite as a proxy for systemic nitric oxide production. So it's a semi-quantitative colorimetric test strip. You can apply some saliva to it. And if it turns dark pink, then that says you have sufficient nitric oxide. If you don't, then that tells us that you're completely devoid of nitric oxide activity. Now, there's some caveats to that test, because if you're low, you're low. There are no false positives. There are no false negatives. But it doesn't tell us why you're deficient. Do you have endothelial dysfunction? Do you have oral dysbiosis? Are you not eating enough nitrate in your diet? So you can begin to interrogate those and then get an understanding. But there are false positives, and we've run into that people that present with high blood pressure, diabetes, erectile dysfunction, obesity, and their test strip is bright pink. And what we're finding is those patients have an active oral infection, whether it's periodontal disease or gingivitis or an infected root canal. And then it's the local activation of the immune system that's causing the increase in salivary nitrite. And it's not due to systemic NO production. In fact, that shuts down systemic NO production. So it's I tell people it's a good tool to have in your toolbox, but it's not the only tool you should be using. So to get back to your original question, the best kind of sign of nitric oxide deficiency or symptoms and clinical presentations. Sexual dysfunction, erectile dysfunction in both men and women is typically the first sign and symptom, because if you can't generate nitric oxide to dilate the blood vessels of the sex organs, you don't get engorgement and you don't get an erection in men or women, and you become anorgasmic. If you develop high blood pressure, typically we're finding that probably 90% of the cases with high blood pressure aren't always due to a renin-angiotensin system. It's due to a nitric oxide deficiency. Insulin signaling is dependent upon nitric oxide production. So if you have insulin resistance, if not corrected, you'll develop into full-blown diabetes, which further suppresses nitric oxide production. Mild cognitive disorders, vascular dementia, again, all of that is due to insufficient blood flow and due to loss of nitric oxide production.
Sure. So obviously this test is important. I don't know if we can get it in South Africa. Where do you sort of distribute it from? I think it's important that people could, check and see exactly what's happening. Obviously there's, some errors with it, but it gives some type of indication in terms of the nitric oxide production. So are we able to get it in Africa?
Yeah, they're readily available. I mean, I've got a couple of manufacturers that make them in 2 different brands. So yeah, they should be readily accessible there in South Africa.
Well, we'll check afterwards and see if there's links and we can get them. Yeah, I think that's very, very important. And being part of the South African Society of Integrative Medicine, as a group of doctors, I think they'd be very interested to have a look at that test. But now, in terms of nitric oxide, let's talk not about food, because I know there's a lot to talk about food and nutrition, because I think there's other things, if we look at mastication and the, chewing of food, looking at the oral microbiome, and then also look at breathing. I had Patrick McEwen. He's an international expert on breathing. He speaks about nitric oxide in terms of specific breath work that needs to be done. Let's look at some of those techniques so that people can implement them into their lifestyles and habits to improve nitric oxide.
Well, all of those techniques are dependent upon the function of one enzyme that's called nitric oxide synthase. So if that enzyme is functional, that enzyme is found in our endothelial cells, it's found in our epithelial cells and our nasopharynx passage. And so when we activate it, so for instance, when we start to exercise, that causes shear stress in the lining of the blood vessel. It tells our body, tells our enzyme, I need to make nitric oxide to deliver more oxygen to these tissues. And so as long as that enzyme is functional, it's activated, it makes nitric oxide. The same thing with that enzyme in the epithelial cells, the cells that line the airways and the gastrointestinal tract, that if it's functional, when we deep breathe, it causes a mechanoreceptor activation that tells that enzyme to make nitric oxide. And then it generates nitric oxide. You can deliver it to the pulmonary vasculature, to the bronchioles, and dilate the bronchioles, dilate the pulmonary circulation, and improve oxygen uptake in delivery. The problem is in people that have what's called endothelial dysfunction, which means that the nitric oxide synthase enzyme is uncoupled and it can no longer make nitric oxide. So then you can activate it or stimulate it. You can start to exercise, but the enzyme is not functional and you're not going to make nitric oxide. So if you have endothelial dysfunction, you have epithelial dysfunction, because the same conditions that cause uncoupling of the NOS enzyme in the endothelial cells are present in the epithelial cells. And so in those patients, you can deep breathe, which there are other benefits of deep breathing, but you're not going to maximize that until you restore the function of the NOS enzyme. And that, I think, is the biggest misconception of both clinicians and the general public, because there's lots of good strategies you can do, but all of it is dependent upon the activity of the enzyme. And if you don't first work to restore the function of that enzyme, those are going to be for naught. And so I tell people, it's like putting gas in a car with a blown up engine, right? If the engine doesn't work, the fuel doesn't matter. So you got to fix the engine, and then you can employ these strategies and maximize the effects.
So how do we improve the engine, the NOS system?
Well, there are a number of ways you can do it. So it's getting down to the basic biochemistry. The oxidation of a single cofactor called tetrahydrobiopterin is what leads to NOS uncoupling. So it goes back to, that's the complexity of it, but the simplicity is you got to prevent oxidative stress, inflammation, and immune dysfunction. And so we have to eat a diet that's enriched in antioxidants to prevent the oxidation. We've got to limit our exposure to toxic chemicals, herbicides, pesticides. There's now clear evidence that EMF and 5G that vibrational frequency disrupts nitric oxide production. So it's very difficult. We live in a very toxic world, and it's very difficult to stay healthy. But again, it goes back to just diet and lifestyle. Eating a good balanced diet with a lot of green leafy vegetables, getting moderate physical exercise, and then allowing for excretion of toxins. That's sweating, that's drinking good clean water, having normal bowel movements, and just deep breathing to excrete all the toxins we're exposed to.
So you've actually got to really just work on the nitric oxide synthase first, and then that allows you to convert the nitrate into NO. Is that correct? So basically there's certain techniques that you have to sort of prepare the foundation to ensure that you can do the conversion.
Well, there are two independent pathways that we thought originally weren't interconnected. So the function of the NOS enzyme is completely independent upon the conversion of nitrate to nitrite and nitric oxide. So the first pathway that we're talking about is nitric oxide synthase. That's dependent upon the activity of the enzyme. The conversion of nitrate to nitric oxide is dependent upon oral bacteria that then convert the nitrate that's secreted in our saliva into nitrite. Then when we swallow our own saliva, we get a burst of nitric oxide gas. But again, that's dependent upon stomach acid production.
Sure.
So if we just focus on the nitrate pathway, that requires several things. Number one, you have to get sufficient nitrate from the diet. And we've done food surveys from all around the world and find that most people are nitrate deficient. And then number two, it's dependent upon the presence of nitrate reducing bacteria in the oral cavity. If you use mouthwash, 200 million Americans wake up every morning and use mouthwash. It kills the good bacteria. It shuts down nitric oxide production. It causes your blood pressure to go up, and you lose the protective benefits of exercise.
Wow.
So 200 million Americans use mouthwash. 200 million Americans have an unsafe elevation in blood pressure. We and others have published on this that's causal for hypertension. So you have to stop using mouthwash. The other thing I tell people is fluoride. Fluoride's an antiseptic. It kills the good bacteria. It's a neurotoxin, and it kills your thyroid function. So you have to get rid of fluoride in your toothpaste and your rinses. Fluoride is bad news.
Yeah.
And then the other problem is once you correct that, then if you don't have sufficient stomach acid production, then this shuts down nitric oxide production. So in the US, I don't know about South Africa, but there are over 200 million prescriptions written every year for antacids. And the majority of these are proton pump inhibitors. And proton pump inhibitors completely disrupt and shut down nitric oxide production. In fact, there's data published several years ago that people who have been on PPIs for 3 to 5 years have about a 35% higher incidence of heart attack and stroke. So mechanistically, that's because it's shutting down nitric oxide production. So those are the simplest things. If you just get out of the body's way, let the body do its job.
Yeah.
Sometimes it's a lot smarter than we are, and you just got to get out of its way. So stop using mouthwash, get rid of fluoride, and get rid of antacids.
Okay, let's distill there. There's quite a lot there, and I think that's very, very important for people to realize, because we got to put a foundation in place first. But in terms of the oral microbiome, it's almost one tube. We're looking at, the whole gastrointestinal tract. Obviously what's happening in your gut's happening in your mouth, what's happening in your rectum and your anus is happening through the whole GI. And obviously we need to ensure that we, have the correct, both gut microbiomes in place. What do you suggest people do with regards to ensuring that they've got a good oral microbiome? We spoke about antiseptic, mouthwashes. I use a fluoride-free, it's a natural mouthwash as long as it doesn't kill bacteria. What else is important with regards to oral microbiome? Do we take an oral sort of probiotic, take prebiotic fiber and make sure that it dissolves in your mouth? How important is it to sort of repopulate the microbiome in the mouth?
Well, I think it's critical, and I think the science and especially the clinical data are showing that. So, what we find, we published on this, I think, in 2015, that the greater the diversity of the oral microbiome, the better nitric oxide production you have. So there's several things you've got to do. And if you have gum disease, gingivitis, periodontitis, typically the bad guys will outcompete the good guys. So you have to get your oral health. If you have bad oral health, then you have to get it fixed. And then, we found a number of patents. We've recognized the nitrate reducing bacteria that we can predict steady state blood pressure across many different patient populations. But to answer your question, there's not any oral probiotics that I've found on the market and tested that restore the function of these nitrate reducing bacteria. But I think it's quite simple. And we published on this, I think, in 2017, that if you simply give more nitrate through the diet, then these bacteria that we're interested in are what's called facultative anaerobic bacteria, meaning that if you give them oxygen or carbon, then they'll respire on that. But if not, then they'll use nitrogen. And so if you preferentially feed them nitrate, which you can do through a plant-based diet or taking a standardized nitrate product, then that acts as a prebiotic. So it wakes these bacteria up, allows them to expand their numbers, and then all of a sudden the good guys outcompete the bad guys, and your body, the ecology of the oral microbiome restores itself. So it may be just as simple as adding more nitrate in your diet that could increase the diversity of the oral microbiome, improve your own nitric oxide production through this pathway, and maybe not a need to take probiotics, maybe prebiotics.
Were these studies done on people that were having mouthwash, that were having antibiotics? The antibiotic goes in the mouth, they're using cortisone, they're using other issues in this area. I mean, you just give nitrates? I mean, it sounds like, I think the average antibiotic kills a third of all your microbiome in your gut, whether there's 100 trillion or, there's a whole discrepancy about, how many human cells we've got and what our sort of microbiota is composed of. But, with the pernicious activity and pervasiveness of antibiotics and mouthwashes, it sounds like it, I can't I'm struggling with the concept of just having more nitrates and you've got these specific bacteria that are crucially important in your mouth and obviously down your esophagus and into your gut that are important.
Yeah, no, it's a very good point. And so the data we published on in, I think it was 2016 or 2017, was in rats. Because we control the diet of the rats, we control their environment. And so there you have a controlled situation. It's very hard to control the diet and the activity of humans.
Yeah.
In fact, it's probably impossible. So what we did, it was a proof of principle study just showing if we give more nitrate through the diet, and we did tongue scrapings on these rats and we measured their blood pressure normalized, the diversity of the oral microbiome improved, and we were able to culture more of these nitrate reducing bacteria. So does that translate into humans? The short answer is we don't know. But anecdotally, we can see by using our test strip that if you just add more nitrate in the diet, then the ability to convert the test strip seems to improve. And we can see this within 90 minutes. But to your point, if you continue to use mouthwash, if you continually have a bad diet, and don't monitor all these other stress hormones and all these other things, then I think it's going to continually disrupt that oral microbiome. So you have to make a lot of changes. We understand what it takes to make the nitric oxide production pathways work, and we've got product technology that can overcome that. But unless you fix the reason you got sick in the first place, then we're basically just putting a Band-Aid on a bleeding wound. You have to get to the root cause of it.
Good. Let's talk about hydrogen peroxide, ozone. A lot of these therapies that I've used, I'm using, I interviewed Dr. Thomas Levy, the cardiologist, incredible a doctor, and Dr. Brownstein that uses hydrogen peroxide, both through a nebulizer as well as one of these water flossers. And it's improved my oral health. I mean, my oral health is really, really good. I'm at a biological dentist. We use ozone rectally, vaginally. It's really, it's really, and this was a question I got from a lot of functional medicine doctors, is that if you use ozone, you kill all the good bacteria and you kill the bad bacteria, which is actually not true. You actually destroy the bad bacteria and you actually proliferate some really good bacteria. So what do you think the use of hydrogen peroxide nasally to help the system, as well as hydrogen peroxide in a water floss? I don't floss with traditional floss anymore. I use this flosser with a 1% hydrogen peroxide solution, as well as doing a lot of ozone rectally that has improved significant gut and colon health. What are your views on that?
Well, look, I'm a big fan of ozone. I use IV ozone. I carry an ozone generator with me when I'm on a plane every week and in my hotel rooms to kind of clear the air. And so I think the data are very clear. It's very beneficial. I mean, it's potent antiviral, antimicrobial. And look, you're basically just putting supercharged oxygen in there, right? And most pathogenic bacteria are strict anaerobes. They do not like oxygen. And so they reside in areas of the body where there's ischemia and hypoxia. And so if you can open up the blood vessels or hit them with oxygen or even ozone, then it kills them. But again, until you get to the root cause of, the limitation of blood flow and ischemia, what we call ischemia, to those particular regions where there's active infection in the body, then they're never going to clear up. Then you can use modalities like ozone. And now for hydrogen peroxide, I think an episodic peroxide rinse in the oral cavity is good. And so, most people focus on the gingival tissue because that's where the caries causing bacteria that causes periodontal disease. I think, and even I do, using hydrogen peroxide in a water pick on occasions, once or twice a week, just to flush out the gums, flush out any food debris that we can't get with a toothbrush, and then eradicate those bacteria in the gingival tissue. So the ecology of what's in the gingival tissue is much different than what's in the dorsal part of the tongue. So the ecology in the oral cavity is different than the gingival tissue than what's on the tongue. What we focus on is the dorsal part of the tongue and that live deep in the crypts, and these are the facultative anaerobes. So I think as long as you're doing a rinse with the hydrogen peroxide with a water pick and you're flushing the gingival tissue, but you're not putting in the back of your mouth and gargling, then I think it's a good balance of getting rid of the bad guys while maintaining the ecology of the good guys.
Okay, brilliant. Okay, so let's talk about nutrition, what people can actually take in their diets, what's really, really important that's going to improve this system, and what people need to take out of their diets. You've obviously spoken about inflammation and oxidative stress, and maybe we can do a bit of functional medicine and sort of unpack how you measure oxidative stress, because it's something that is crucially important from a functional medicine root cause point of view. But tell us about diet and nutrition. Firstly, from mastication, how long you chew your food. I've listened to a lot of podcasts. I've followed you for a while. I mean, I can't speak more highly. You're an international hero. You've dedicated your life. But tell us about your habits in terms of chewing food and swallowing, how that works from your nutritional point of view.
Well, once you understand basic physiology and how the body's designed to digest food and to extract nutrients from the food, which is the whole purpose of nutrition and consuming food, is for energy and to maintain certain nutrients, is that we have to break down that. So whether we're eating plants or animal tissue, the first step in that is to masticate and to adequately chew the material so that you can break it down into the smallest particles so that you increase the surface area. And then chewing your food allows for a specific resident time in the mouth, right? So there are bacteria in the mouth that help humans do things that we haven't evolved to do. One of those is metabolizing nitrate into nitric oxide, because humans do not have that insight. So I think it's very important. You have to chew your food. You have to eat very slowly. And people who eat fast, don't chew their food, swallow it whole, have poor digestion. And then, they've engorged themselves before the satiety hormones start kicking in to say, hey, you know what? I'm full. And then you stop eating. And I think those practices, especially, I've traveled all over the world. In certain cultures, you sit down, you eat, you have conversation, you eat slowly, and you find that, 25% of the food you eat here in the US, you'll get a feeling of fullness and satiety if you just slow down and do that. Because then the body has a chance to react to that. And hormones start to kick in and say, hey, you know what? I've had enough. So I think chewing your food for a long time to physically break down so it can be further digested in the acid environment of the stomach. But that requires stomach acid production. So if your body can't make stomach acid, you cannot break down proteins into amino acids. The consequences of that are your stomach starts to reflux because you've got what the body recognizes as a foreign object or a foreign antigen, and so it tries to get rid of it. And that's the basis for acid reflux. Acid reflux is a symptom of insufficient stomach acid production because it's trying to get this stuff out of your body that it can't break down. And then when you go through gastric emptying and you empty those contents into the gut, these undigested peptide fragments are then absorbed across the gut. Your body develops an antibody against it. And then you have foodborne allergies. Then over time, you develop autoimmunity. And it's just this constant cycle that nobody corrects. And then you go to a physician and he puts you on a proton pump inhibitor or an antacid, and it makes things worse. And now you can't absorb minerals like iron and zinc, calcium, iodine, you become osteoporotic, and a number of other diseases set in. So for me, the human body is very, very complex, but the underlying physiology and biochemistry is very simple if you think about it. Just give the body what it needs, remove from the body what it doesn't need, and the body heals itself.
Okay. What about people on a carnivore diet that have said it's made a significant difference? Do they lack nitrates or nitrites in their diets? And what do you think about, people on a ketogenic diet? They're not having a lot of plant-based foods that have nitrates in.
Yeah, no, I think it's a problem. I don't think any extreme diet, whether it's a straight vegan diet or a straight ketogenic carnivore diet, is sustainable long-term. We're designed and we've evolved to eat a balanced diet. And I think it's very difficult to make broad recommendation because every one of us is different. And a lot of times that's what makes us different. So we have different nutrient demands than other people. And I think blood type has a lot to do with it. So people who, to answer your question, people who eat a strictly carnivore diet aren't getting enough nitrate in their diet. And so they almost have to supplement. And, acutely, they may see some benefits of it, but this diet cannot be maintained for long periods of time just because there's not a lot of antioxidants in that diet. And a carnivore diet, there's postprandial oxidative stress that occurs in breaking down all that protein and fat. And we have to offset that by, some antioxidants. And so if you look at social norms, it makes perfect sense. So at least in the US, most meals are preceded by a salad, right? So we eat the green leafy vegetables, and then 20 or 30 minutes later, we're getting our main course. And then during that time, it takes about 60 to 90 minutes for that nitrate in the salad to be converted through the body. Now we have vascular protection that prevents the inflammation and the oxidative stress from breaking down that high protein, high fat meal that we're about to consume. So I think you have to eat a diet, or at least you have to supplement prior to eating a high protein, high fat meal to protect the vascular endothelium.
In South Africa, 80% of individuals or the population have hypertension. You said that that's probably an indication of low nitric oxide. Obviously, there's a lot of root causes. We're busy going through the process of talking about that. But that's, how is that sort of nitric oxide related to the sympathetic nervous system and the parasympathetic nervous system? We'll talk about the techniques like breath work and exercise a little bit later. But is that directly related to low NO if you've got hypertension?
Well, in most cases, I would say yes. But look, the body always responds to a stimulus, right? And probably no different than in the US, people in South America are, on sympathetic overdrive. They have dysautonomia. They're on, everybody's stressed. And it's always a fight or flight mode rather than the rest and digest. And so that wreaks havoc on the cardiovascular system. And there's studies showing that chronic overproduction of cortisol causes endothelial dysfunction. And so, as I tell people, it's foundational to restore nitric oxide production because without it, your body cannot and will not heal. But if you don't correct these other problems, nitric oxide is not going to correct your autonomic nervous system. Nitric oxide is not going to correct the testosterone or estrogen deficiency, but it's foundational for everything you do going forward. So we have to balance the autonomic nervous system. We have to balance other hormones. But in order to do that, you first have to restore the function of nitric oxide production. So it's not a silver bullet, but as I said, it's foundational that everything you do going forward will work much better or may not even actually work at all until you restore the production of nitric oxide.
Brilliant. Food specifically from beets to arugula, or known as rocket, celery, lettuce. What are the things that should people have on a regular basis to help those nitrites and nitrates?
Well, generally speaking, the darker the vegetable, the darker the green vegetable, the higher the nitrate content. So things like kale, arugula, spinach, those are the dark green leafy vegetables that, on average contain the highest amount of nitrate. But in 2015, we went around the US and we measured, I think 5 or 6 different vegetables across 5 different cities, from New York to Raleigh to Dallas, Chicago, and Los Angeles, all points of the US. And we found as much as a 50-fold difference in the amount of nitrate in broccoli and celery and cabbage in one US city as opposed to the other. So there's high variability in the nitrate content within the same vegetable in different geographic regions in the US. And we found that this is due to different farming practices, the amount of nitrogen in the soil. And these were conventionally grown vegetables. We also compared them to organically grown vegetables. And organically grown vegetables have 10 times less nitrate across the board. So that is shocking to a lot of people because we think it's good and we're encouraged to eat organic vegetables just because we're not going to be exposed to herbicides and pesticides. But we've done the stoichiometric calculations on that. You cannot eat enough green leafy vegetables to get enough nitrate to produce nitric oxide to manage your blood pressure. So, and when you think about this, an organic label doesn't allow you to add nitrogen to the soil. So there's no standardization of nitrogen. And without nitrogen in the soil, you can't assimilate other nutrients like trace minerals like chromium and selenium and zinc, vitamin A, vitamin D. So if your organic vegetables are deficient in nitrate, they're deficient in many other nutrients. So it's a balance here. And again, I don't know the solution because you only get enough nitrate from conventionally grown vegetables, but then you risk, are they genetically modified? Have they been sprayed with glyphosate or other herbicides? But I think what we do, and I'm fortunate, I live on 800 acres in Texas and we grow our own food. So we raise our own beef, we grow our own vegetables, we put nitrogen in the soil, but we certainly don't add any chemicals to the food we eat.
Sure. That's a tricky one, having Dr. Stephanie Seneff, the MIT professor on glyphosate, saying that's destroying our microbiome, that's causing significant immune dysregulation. Her big reason why people have really struggled with C19 is because of all this glyphosate. I think the state of Kentucky, 75% of the air and water is filled with glyphosate, and she's moved to Hawaii or Kauai. So it looks like there's some significant problems, with now you got to eat vegetables, and now they're not organic, but now they don't have the correct minerals. What type of functional medicine test would you say, people would look at, like an organic acids test, or, something to have a look at what's happening from a, deeper mineral perspective, so that people can say, hang on, I am eating organic, I am doing some supplementation, which we'll talk about a bit later, and I am getting the minerals that I need to get in my diet, either through supplementation or food. What test would you recommend?
Well, I think the organic acid test is very useful because, especially in chronically ill people when conventional medicine has failed them, they can't find the root cause. That offers a lot of insight into things that may be exposed to without their knowledge. The other thing are in chronically ill people that, it's widely underdiagnosed is molds and mycotoxins. I think that's a critical test that people need. But the other thing is, most people in surveys in the US, most people are taking supplements. But what people don't understand is they may not be absorbing those supplements and those minerals. So you have to have stomach acid, in the gastric lumen in order to absorb things like iron and zinc and selenium and chromium. So you may be taking these, but if you don't have stomach acid to help absorb them, then you're just going to excrete them out. So the other thing I like to do is, a micronutrient test, and to do blood and just see what micronutrients your body may be deficient in, or what you may be overdoing in. Because, just like too little of one thing can be bad, too much of one thing can be bad. And so it's all about balance. So I think the testing is good because it gives you a sense of where you are. And then you can begin to kind of interrogate, okay, what am I doing that's not allowing the absorption of iron? Why am I still anemic if I'm taking them? And then if you have, a pretty astute functional medicine doc, then you can figure out the problem.
A dried blood spot analysis of amino acids, having a look at, how important things like arginine and citrulline with regards to NO, things like glutamine, lysine. Do you recommend that? I know that I've done that as an athlete. I've run many, many marathons over the years, over 40,000 kilometers in the last 27 years. I love my exercise, but I was really low on arginine. So I've supplemented with arginine. I haven't noticed any difference. I've got, in 23 years of practice, I'm grateful that I've never missed a day's work to sickness or ill health at all. But I'm doing it preventively to prevent issues possibly later. How important are the amino acid tests, Dr. Bryan?
Well, look, there's essential amino acids, there's semi-essential amino acids. So essential means that we have to get them from our diet because our body doesn't produce them at a normal flux to maintain normal metabolic activity. So things like arginine and citrulline are considered semi-essential amino acids, meaning that your body produces it endogenously, but you also get it from the breakdown of proteins. So one can compensate for the other. But if you don't have stomach acid to break down proteins into the constituent amino acids, because our body is designed to take up amino acids, not take up intact proteins. So stomach acid is critically important there. But I think if you do an amino acid blood test, it will certainly tell you a lot. So if you're but there's regulatory systems within the human body. And this has been played out in the clinical literature with arginine. So if you supplement high dose arginine, you basically can shuttle the arginine away from nitric oxide production. So too much arginine in the body, you'll start to see an upregulation of an enzyme called arginase. And then arginase will basically excrete arginine into the ornithine and urea cycle, and you'll just excrete it through urine and urea. So there's a balance here. And then there's only one condition where there's an L-arginine deficiency, and that's in a rare inborn error metabolism called arginosuccinic aciduria, where these kids are born without an enzyme called arginosuccinate lyase, and they can't make arginine. So then you have to supplement them. So that's the only reason, the only clinical condition where I would recommend arginine supplementation. But as long as you can make stomach acid, and as long as you don't have an underlying urea cycle disorder, then your body is always making enough arginine to theoretically saturate the NOS enzyme for optimal NO production.
Okay.
So and the biochemistry is well defined. So the Michaelis constant, or the amount of arginine you need to bind the NOS enzyme, is 5 micromolar. But even in the sickest of the sickest patients, their blood levels and intracellular levels of arginine are 20 to 50 micromolar. 5 to 10 times higher than what's needed to saturate the enzyme. So you don't need to take extracellular arginine. Yeah.
Okay, that's fascinating. Let's do. How do you diagnose someone with low sort of stomach acid? I think this is very, very important. We've got sort of this elimination process where we give people betaine HCl just before a protein meal, try and increase it and see if they digest it better, especially females. They're often very alkaline and they can't digest protein, which is sometimes a sign of, low stomach acid. But take us through a little bit of your own process with regards to low stomach acid and how you test it and what do you do about it?
Well, unless you do a scope and measure, there's really no way to test for it that I'm aware of. So we look at symptoms. People who have poor digestion, people who have autoimmune disease or foodborne allergies, then that tells me that they don't have enough stomach acid. So again, just like I'm trained in biochemistry, you have to go back and look at the chemical reaction that the body uses to make stomach acid, and then figure out what's missing. So to make stomach acid, your parietal cells need iodine, they need zinc, they need B vitamins, and they need sodium bicarb. And so most people are deficient in iodine. In fact, 95% of Americans are deficient in iodine. And if you don't have iodine, you don't have proper thyroid function, which is another epidemic here in the Western world. And then if you can't make stomach acid, you can't absorb iron, you can't absorb zinc, which you need for stomach acid production, and you can't absorb iodine. So it's this perpetual cycle that until you start to get stomach acid production, you're going to be deficient in all these. So similar to you, I tell people take apple cider vinegar before every meal. That way you acidify the lumen of the stomach with acetic acid, which is vinegar. And you acidify that, so you leads to better digestion, better protein breakdown, better absorption of nutrients. Or you can take betaine hydrochloride, or you take iodine, zinc, B vitamins along with the betaine hydrochloride, and then you give your body what it needs to. Your parietal cells can make hydrochloric acid, and it's self-correcting. And so it's really that simple.
Sure. Fantastic. Okay. Exercise, aerobic exercise, anaerobic exercise, high intensity interval training. What are the different forms of exercise that produce NO?
Well, they each have their play in the whole system, but in order for the endothelial cells to make nitric oxide, you have to have oxygen. So when you run out of oxygen, then nitric oxide production in the endothelium shuts down. And then that's when you switch to, your so-called anaerobic threshold. Then you start to, get lactic acid buildup in this fermentation, and that, you get poor recovery. So I think if you just want to enhance your cardiovascular health and stimulate nitric oxide production, then aerobic exercise is the best. If you want chronic adaptive effects and increased vascularity, increased nitric oxide chronically, then I think the high intensity interval training, because these brief periods of hypoxia and ischemia tell the body, I need to make more nitric oxide, I need to make new blood vessels to better perfuse these organs, because I didn't like it when I was out of oxygen, so I never want that to happen again. And it's an adaptive effect. So then you get mitochondrial biogenesis, you improve mitochondrial ATP production. And so I think it's a good mix between both of those. And personally, for me, I start every workout with a 20 or 30-minute run, kind of a low, probably my heart rate gets up to maybe 114 beats a minute. It's a nice, comfortable pace. I usually run 1 mile every 10 minutes. So 20 or 30 minutes, I can get 2 or 3 miles in. And then I do high intensity interval training. And I'll do that for probably 12 or 15 minutes. And then after that, I go sit in a sauna and I stretch and try to recover and just practice deep breathing exercise. So that seems to work for me. I'm 48 years old, and similar to you, I haven't lost a day of work in 25 years. I've never been sick from COVID. I haven't been sick with the flu or any viral infection in more than 25 years. So, and I'm on a plane every week. I'm in COVID clinics every week. We have a COVID drug trial. So I'm exposed to a lot of things, but I think if we fortify our body, our body knows how to deal with these pathogens and we don't get sick from it.
Okay, so a combination aerobic, anaerobic. Let's look at something like fasting. Has that, helped with NO? Does it give a bit of a gut reset and that helps with the production of nitric oxide?
Sure. Yeah, now the data are clear that fasting has improved effects on longevity and just overall health. And the mechanism is now very clear. So you get an upregulation of the sirtuins and PGC1 alpha, and all of that is dependent upon nitric oxide. So that actually helps improve nitric oxide production, provided the enzyme is functional. And then again, it's one of these adaptive effects. It's giving your body a signal that says, hey, I have to become more efficient because I may be without food or energy for the next 16 hours. And I've got to become much more efficient at utilizing my resources. So I do a 16-hour fast every day. I eat my last meal of the day around 5:30 or 6, and I don't break that fast until noon the next day.
Fantastic. Let's talk about light. When I go into the sun, I've got Greek blood in me. My parents live in Cyprus. I love the sun. I've never used any type of sun cream. I don't believe in SPFs. I don't believe in you burning at all. I think burning is a real problem, but I think if you've got a good nutrient-dense diet and you build up a solar callus slowly, getting into the sun, I'm very relaxed afterwards. Blood pressure drops significantly. How does that affect NO?
Well, there's certain wavelengths of light, along the entire spectrum that we get from sunlight, that's affecting nitric oxide production. And as you said, the epidemiology is very clear. People who live near the equator typically have much lower blood pressure than people who live, for example, in the Scandinavian countries where there's limited sunlight throughout the year. And that's due to the production of nitric oxide. So near infrared light can actually produce nitric oxide that's bound to metals. So when nitric oxide is produced, it hits its cellular target and then it kind of stays there, then it's oxidized. So if we have a lot of nitric oxide and we expose to sunlight or UV or ultraviolet, then it'll re-release that nitric oxide. And we call these photolabile stores. So you can actually lower blood pressure then. And the ultraviolet spectrum, the other end of the spectrum, you can actually cleave nitric oxide bound to cysteine thiols and proteins. So we have to get exposure to sunlight. And even in the winter, I have an infrared sauna in my home that I sit in every night, especially during the winter. So we have to be exposed to this in order to maintain some level of photoactivity. And it's not just conversion of active vitamin D, but there's a clear role for nitric oxide. And so I've never used sunscreen. I don't put it on my kids. I think we have to be smart. The chemicals in the sunscreen are much more dangerous than moderate sunlight exposure. So you just have to be smart. Put clothes on, wear a hat, cover your face with clothing, but never cover your face and entire body with any sunscreen because they're very toxic. I think the incidence of the cases of melanoma and dermatitis and things like that they attribute to sunlight exposure are due to the sunscreen rather than the sunlight.
Yeah, sure. Fantastic. I'm a big believer in infrared sauna. I've got one right here in the office. I'm in there 6 days a week, and my kids and my wife. Really powerful. I know it's sort of a bit of a tangent, but do you take anything before you get in there, like a zeolite, or do you take like an activated charcoal as a binder before you get in the infrared sauna? Do you have a little bit of a protocol? Because I'm trying to develop something, share with my community. I take spirulina, chlorella, a little bit of zeolite, a little bit of activated charcoal before I get in, just 5 minutes before I get in. And I find that has really, really helped some of my heavy metal testing that I've done before getting the sauna and afterwards.
Yeah, absolutely. I take chlorella and spirulina before I get in the sauna, and the zeolite or charcoal. Because what we're doing here, the other thing I take is usually 750 milligrams of niacin. And so niacin causes a flush, but more importantly, it causes lipolysis. And most toxic chemicals that are stored in your body are fat soluble. So the 750 milligrams of niacin is a whopping dose. You'll flush, your ears will turn bright red. You may get a little bit of turn red. But then once you feel that flush, you get in the sauna, and then you're liberating those toxic chemicals, and you sweat them out. And then when you have the zeolite, the charcoal, or the spirulina and chlorella on board, they act as binders, and then you help your body excrete them. So the last thing you want to do is mobilize toxins in your body and not be able to excrete them, because then you're going to get sick again, right? Because your body's exposing them to those. So yeah, there are these, and I learned that from an old physician who was treating Vietnam veterans who came back with Agent Orange exposure. And the only way he could get these patients better was through 750 milligrams of niacin to cause lipolysis, release the chemicals, and then put them in an infrared sauna to where they excreted the toxins.
Sure. Wow, fascinating. Okay, so now we do not use mouthwash. That's a biggie. We do not take PPIs. Any other medication that we shouldn't be taking that affects NO?
Yeah, statins. The early data on statins where they had these pleiotropic effects that reduced inflammation. I think that data is still true, but chronic exposure to statins disrupts. So if you get your cholesterol too low, you disrupt the integrity of the cell membrane. And that's where a lot of enzymes are tethered. For instance, the nitric oxide synthase enzyme. So what happens over time, if your cholesterol gets too low, not only do you become deficient in vitamin D and estrogen and testosterone, but this protein complex falls apart and you become nitric oxide deficient. Okay. So I think we have to reevaluate the role of cholesterol and lipids in heart disease. I think the data are clear that cholesterol is not causing heart disease because almost everybody's on a statin, and cardiovascular disease is still the #1 killer of men and women worldwide. Yeah. It has not moved the needle. And in fact, 75% of the people that present with sudden cardiac arrest have as less than 20% occlusion of the coronary arteries. So it's plaque instability caused by the inflammation, not due to the cholesterol plaque.
Sure. I just want to carry on picking your brain, but let's try and close this out now. So firstly, do not use fluoride. We didn't talk about fluoride, but I'm just going to say it there. Use a toothpaste that does not have fluoride in, because that's an antiseptic that really affects your oral microbiome. Do not use mouthwash because it damages or destroys your oral microbiome. Be cautious of PPIs. Be very cautious of statins. Then we want to eat a high nitrate diet. Obviously, we've got to be also where the organic acid test tells us about oxalic acid, having a lot of these things like kale and spinach. We've got to be aware of that. Make sure that we don't have too many deep, these green, dark vegetables that can cause high oxalic acid, but we need the nitrates. So that's something we need to do. Exercise, aerobic, anaerobic as well. Get as much sunlight as you can without burning as you go there. Incorporate some infrared sauna, near infrared and mid infrared, and possibly red light, which is really, really important in terms of NO production. What have we missed, Dr. Bryan? Anything else that you would recommend that people could, follow?
I think it's you put it very succinctly. And so, the science of nitric oxide is very complex, but it's really very simple. Stop doing the things that disrupt nitric oxide production and start doing the things that have been clinically proven to stimulate it and activate it. That's moderate physical exercise, exposure to sauna. And most people have a hard time changing their lifestyle and their habits. And so we've created product technology that if you don't want to do that or you can't do that, then we have products you can take that actually do it for you.
Maybe let's talk about that. I know you're not punting your products. I know that I've listened to a lot of, of your podcasts. You really wanted people to change their lifestyles. But let's talk about your products, how they work in terms of producing NO.
Yeah, so we've got a number of products on the market, and my goal now that I'm retired from full-time academia is to introduce safe and effective nitric oxide product technologies in every major market segment around the world. Now, we've done this, and our philosophy is that we have to understand the mechanism of disease to the extent that we can fix it. And so we know how to do that with nitric oxide. So we have an orally disintegrating tablet, several versions of that now on the market, where you put it in your mouth, it slowly dissolves over 5 to 6 minutes, and we generate nitric oxide gas. The only technology in the world that does that. So our philosophy was, if your body can't make nitric oxide, then we have to do it for you. So that works beautifully. And then we have some powders that you can mix in water that we use for pre-workout that generate nitric oxide that'll get you through that anaerobic part of exercise. So when endogenous NO production stops, what we give you basically pushes that anaerobic threshold back and makes you more efficient with lower oxygen. We've got a standard nitrate capsule. So if you want to take the guesswork out of your vegetables, are you getting enough nitrate without the oxalates? We've got a standardized nitrate capsule that you can take. And then we've got FDA drugs that we're developing specifically for the specific indications. You know, for example, we've got a drug for COVID that's in phase 3 clinical trials. We're getting very good data from that trial. We're keeping people out of the hospital. We're keeping their blood oxygen saturation. In fact, in some patients, we're seeing their blood oxygen saturation go from 78 to 96 within 10 minutes of taking the nitric oxide drug. We've got preliminary data. We're about to start an Alzheimer's drug study. We find that the earliest stages of Alzheimer's is vascular dementia, reduce blood flow to certain regions of the brain. So if we can restore blood flow to the brain, we can get the good nutrients in, we can get the waste products out, no beta amyloid, no tangles, which is the hallmarks of Alzheimer's. We've got another IND or investigational new drug application going in for ischemic non-obstructive coronary artery disease, to which there's no standard effective treatment. This is a growing condition affecting primarily women in their 40s and 50s. It's a small vessel disease. We find that our nitric oxide not only opens up the resistance arteries, but opens up the microcapillaries and perfuses the heart. And then we developed a topical drug technology for diabetic ulcers. And that's, I think, COVID's exciting because we've dealt with this for 2 years, and therapeutics weren't the main focus of the federal government here. It was more vaccines, but our therapy is very, very effective, and more importantly than that, it's safe. But the topical drug technology, there's been no innovations made in wound care in 50 years. We're still treating wounds the same way we did 50 years ago. Negative pressure, some collagen, collagenase, and things like that. So we're seeing 3 to 4 year old non-healing diabetic ulcers completely healed within 90 days of applying our topical nitric oxide. Sure. And it makes sense from wound healing, because most wounds are infected, and every wound is characterized by decreased blood flow. So what does nitric oxide do? You apply it topically, it kills the bacteria, and it causes increased blood flow to the wound. You get granulation, you get the immune response, and the body heals itself. It makes perfect sense. And so we're very excited about that.
Wow. Sure. There's a lot going on there. You forgot your last product, Dr. Nathan, is the product of living on an 800-acre farm in Texas. Isn't that one of your products that you're going to be offering?
But that's a kind of an unintended consequence.
But that's exciting because there's a lot of products out there, Dr. Nathan, that have been promised like to improve NO. And I know you've done a lot of studies. It doesn't seem like there's, sort of genuineness to a lot of these things. How does the consumer or the person listening, how do they know whether these things are absolute fast or they're actually going to work? And, looking at your products, are there research studies? Just give us a little bit of an overview of how important it is for people to check out these products and what they can do to investigate, the manufacturers.
Well, unfortunately, it's the wild, wild west still in the so-called supplement and nutritional space, because basically everybody can say the same thing. Everybody can make the same claim, but there's very few product companies who put their products to the test. So I tell people, look for published clinical trials on products. And most companies, it's hard to find because 99% of the companies out there never put their product through a clinical trial. And the reason for that is they're very expensive. They cost hundreds of thousands of dollars. And most products will never move the needle on any meaningful clinical endpoint. So companies just don't do it. We always put our products through randomized placebo-controlled clinical trials, even though it's not required here in the US by the FDA. So you have to be aware or beware of creative marketing and deceptive marketing versus real science. And that's why I think it's important to spend some time with you just to properly educate, so consumers can make educated decisions and not make decisions based on emotions by who runs the best commercial or who appeals to, somebody watching the TV program at the time. But, look for products. Obviously, you can Google my name and find products. If my name's on a product, then it's probably one of my products, unless somebody's using my name and likeness without my permission, which has happened before, by the way.
Sure.
Or look for, clinical trials on products. But nitric oxide is extremely important. It's foundational. Your body cannot and will not heal without it. And so I encourage people, even though diet and lifestyle is always the first line of defense, it's not always easy to do that. I'm on the road every, 2 or 3 days a week for the past, 3 or 4 years. So it's very difficult for me to eat a balanced diet, a good diet, when I'm traveling so much. So I take a daily nitric oxide product. I take one before my workouts. I always go to the gym when I arrive at the hotel or wherever I'm at. But look for good, safe, effective products. And that's very difficult to do, but they're out there.
Yeah, well, I've never taken an NO supplement, so maybe we can connect after the show and talk about that. I've been watching my data now since medical school. That's 25 years ago. So, I've got some really good data on my sleep, my bloods, my genetics. So it'll be very interesting to try that. Last question for the Dr. Nathan Bryan. Thank you so much. Is at Made to Thrive, we've seen over many, many years that people change and transform their lives in the short term. They get sick. They then put all these habits in place and lifestyle changes, and they're excited about it. They feel better. And often 6 months, 9 months later, a year later, they're back to their old ways. They're sick again. What is your sort of key, pieces of advice or hacks to help people sustain their transformation?
Well, just with anything, you have to have a reason why. People have to find their why. It's not the how, but it's the why. And so when you figure out what your why is, it's because you want to spend more time with your kids or your grandkids, or you want to accomplish certain things in life. And if you don't have your health, then obviously you can't do that. But we have a very limited time on earth. And I think everybody's put here for a specific reason. People are introduced in our lives at certain times for specific reasons, and we can't squander that time. And our greatest asset is our health. If we don't have our health and we don't feel good, then we can't do our purpose-fulfilled life and live our purpose-filled life here on earth. So you have to find your why. And sometimes people have to dig deep and figure out, why am I here? What is my role? And, once you do that, then you become filled with passion. Like us, I feel very fortunate to recognize the reason for my existence many years ago. So now I have a very clear and focused reason to accomplish as much as I can in a very limited time here on earth. So it's not the how, it's the why. And I think when people do that, then you're going to do whatever it's necessary to achieve your goals. And then all the obstacles disappear, but it takes a discipline. And most people these days don't have discipline. And this takes many, many years to see the reward. And most people today want instant gratification. And that's just not the norm. It typically doesn't happen. There is no immediate gratification in 95% of the things we do in life.
Brilliant. Well said. Well, we declare favor and blessing over you, Dr. Nathan, that you would flourish in your calling and in your purpose, that you will live many, many years. I'm going for 150 years of serious good health. That's what I'm aiming at, and that's what I'm trusting God's going to give me to fulfill my purpose and my calling. So what a privilege to have you on the show. You're a wealth of knowledge. I want to have you back on maybe in 6 months' time discussing, the things of developments. You're obviously in the research as well. You're developing products. You're traveling. You're speaking. So thank you so much. And I just know you're going to go from strength to strength. Your mind's working at a very rapid rate, and we need you to stay very healthy and well. So thank you so much.
Thank you, Steve. It's a great pleasure.